going to?
We're going to anatomy and physiology.
Anatomy and physiology? What is that?
Anatomy is the structure of the human body, while physiology deals with the functions of the human body.
Oh, sweet. Where do I sign up?
Oh my god. Oh my god, he on X Games mode.
Alright, let's take it to the doctor.
What is that?
Hello, Roberto. I'm your doctor, Garcia,
Nice to meet you.
and here's your report on your broken bones. Well, to get a better understanding of what you broke, you should know your anatomical planes. The mid-sagittal plane separates the body into equal right and left halves. The parasagittal plane separates the body into unequal right and left halves. The frontal plane is a vertical plane that separates the body into the anterior and the posterior sections of your body. The anterior, or ventral part, is towards the front, while the posterior and dorsal part is towards the back. Finally, you have the transverse plane, which divides the body into superior and inferior portions. The superior part of your body is towards the head, while the inferior part of your body is towards the lower part of your body.
Okay, so now I know the 4 ways my body can be divided, but how do you pinpoint which parts of my body are injured exactly?
To do that, we have to rely on our knowledge of directional terms. You have one fracture in your sternum, which is medial to your heart. You have another fracture in your left elbow, which is lateral to your left shoulder. Your ring finger, which is intermediate to the middle finger and pinky, is also badly bruised. I saw a muscle tear in your left knee, which is proximal to the shin, as well as in your right ankle, which is distal to your right knee. Finally, you have a minor hairline fracture in your left clavicle, which is deep to the skin, as well as some bruising on the skin, which is superficial to the muscles. You took a really hard hit when you fell down those stairs, but once we're done with the surgery, you should be feeling a lot better within a few days.
All these different terms sound interesting. How can I learn more about my body and the way it works? It's a fascinating thing. I would love to be able to properly identify the sections of my body on my own.
If you want to know more, I would highly recommend that you take anatomy and physiology class at your high school. I know a lot of doctors and nurses who benefited a lot from that class. You want me to get that, Mr. Tallman?
Sure.
Oh man.
Hi, Roberto. How's it going?
Good, how about you?
Have a seat. So, what can I help you with today?
Man, I was talking to my doctor and I was thinking about signing up for anatomy and physiology, but I'm not 100% sure. Do you mind telling me a little bit more about it?
Of course. Well, one of the first and most important things that you'll learn in anatomy and physiology are your prefixes and suffixes. Some examples of prefixes are a, ad, adip, amphi, ana, adi, dorm, contra, fract, and glet. Some examples of that include abiotic, admire, adipose, amphibious, anachronism, and audible. Some suffixes include able, arium, jest, hal, ism, emia, blast, cycle, eus, and gone. And of course, these words are only the beginning. You'll also get to do many interesting things later on in the year, such as dissecting.
Are there any careers I can use my knowledge of anatomy and physiology for?
Of course, doctors, nurses, physician assistants, occupational therapists, and pharmacists all use their knowledge of anatomy and physiology to aid them in their job.
That sounds awesome. Sign me up!
Right.
On your broken bones.
Okay, nice to meet you.
And here's your report on your broken bones.
Alright.
Is a vertical plane that separates the body into the anterior and the posterior sections of your body.
Yeah.
Well, to get a better understanding of what you broke, you should know your anatomical planes. The mid-sagittal plane separates the body into equal right and left halves. The parasagittal plane
Be divided into.
is lateral to your left shoulder. Finger and pinky is also badly bruised. I saw a muscle tear in your left knee, which is proximal to the shin.
I'm trying to. It's a suck-up or what?
Yeah.
All these different terms sound so interesting. How can I
Okay, hold on.
Sure. Do you mind telling me a little bit more about it? I was talking to my
Bruh. Look at this dude.
thinking about
Wait till you see the. No, 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 no.